Okay, everyone. People are still joining, but we'll get started. So thank you all for joining us today. This is our second session of How We Talk with Research Participants. Today we're going to be talking about plain language with our presenter, Beth. Anne and I, sorry, everyone, I'm Allie Molnar, and I'm here with Anne Buffington, and we make up ICTR's Recruitment and Retention Resource Center. We have a couple quick items put in the beginning, and then we'll get into Beth's presentation. Okay. So as I mentioned, this is our second session of our five-part series on how we talk with research participants. We have some upcoming ones. We have another session in October and then one in November and December. You can still sign up for these if you haven't already. If you're a UW employee, you can sign up through the link using Workday. If not, just send Ann and I a message and we can help you get set up with that. So coming up next, we have some folks from the emergency medicine department talking about meaningful engagement using participant-centered communication approaches. And then a quick reminder, so as I said, Ann and I make up the Recruitment and Retention Resource Center. We are here to help research teams however we can related to recruitment and retention. We offer free consultation services, helping plan, troubleshoot your recruitment and retention. We also love to do a material review if you have any materials that you want second set of eyes on. Yeah, and then our email's at the bottom, so feel free to send us an email. And then just a quick few notes and reminders. So we're really happy to have all you with us today to hear Beth's presentation. We definitely encourage questions. You can feel free to unmute and ask your question, or please feel free to put it in the Zoom chat throughout the presentation as well. As a reminder, this will be recorded. We have our past recordings up on our YouTube page, which you can also find from the homepage within our registration page. So after the session, we'll send out the link to the recording. We'll take a summary of any question and answers, and then also we'll have a brief evaluation survey. If you can take a couple of minutes to fill that out, that's super helpful for us. And then also a reminder, please ensure that your questions and Zoom chat comments do not include any confidential information, especially any PHI or any identifying information about study participants. And then if you have any questions about what you can or cannot say to study participants, we recommend it's always great to follow up with your IRB reviewer. So, okay, and I will let you introduce our presenter.
Awesome. Thank you, Allie. So we have with us today a wonderful presenter, Beth Gaytan. Beth Gaytan is with the Office of Human Resources, where she is an English language trainer in cultural linguistic services. And she does so much wonderful work on campus trying to promote plain language communication to help employees communicate better, improve, within an inter-office communication, and also boost customer satisfaction. She's a longtime adult educator working in this field for 20 years, and she's worked with a really interesting array of stakeholders, including healthcare organizations, service industries, manufacturing companies, really just trying to spread the good word about plain language communication across all of these realms. She's also done work providing plain language translations to companies, again, trying to increase efficiency, create positive communication experiences. And then lastly, she's done some interesting work with medical staff and providers trying to improve patient-provider communication. And I think that's relevant to what we'll be talking about today, and really trying to create person-centered healthcare environments and communication opportunities. And I just wanted to add, and this is her official bio that she provided us, but from my vantage point too, just wanted to mention that she's so thoughtful about her work and also just a very kind trainer. So if you have any chance to sign up for additional trainings with Beth, I highly recommend that you do. And we will stop sharing and Beth can pull up her slides.
Thank you so much. All right. And then do you just see my first slide?
Yep, you're good.
Perfect. All right. Well, thank you so much, everybody. I'm really excited to be here today. Yeah, we will get started. So today we're really going to focus on speaking clearly with plain language. A lot of times we think of plain language as writing strategies, but it's as important in speaking as it is in writing. So we're going to start with some examples. And we'll do a waterfall chat to get started. So we will listen to a small portion of a script. And as you listen to this portion of the script, I'd just like you to think about challenges that participants might have. Write in the chat, write 1 to 2 challenges you identify, but don't send it. Only send it when I say send. So again, we'll listen to this small portion of a script. And then in the chat, you can write some challenges participants might have, but don't send until I say to. All right.
Thank you for being interested and potentially participating in the Promoting Imaging Longevity and Optimal
Oh. Hmm.
Thinking, or PILOT, study. The goal of this study is to learn more about how synapse health relates to cognitive function in Alzheimer's disease. Synapses are the tiny connections that allow brain cells to communicate with each other. This study will collect biomarkers and brain scans to study synapses in various stages of health and disease. We'll also look at how a gene called AP may help protect synapse health. Your participation is entirely voluntary. The study involves 2 visits 2 years apart, and each visit will take approximately 6 to 8 hours. You'll be compensated up to $275 for completion of each visit, or $550 for both. Participation in this visit would require that you fast from food, nicotine, caffeine, alcohol, and over-the-counter medications for 10 hours prior to the blood draw portion of the visit. Additionally, a 4-hour fast from caffeine and a 2-hour fast from nicotine will be asked of participants for the MRI. You may drink water as normal, and we encourage you to drink as much of it as you'd like. There are some risks associated with fasting. If you experience any of the following symptoms, please discontinue your fast and contact us at that time: shakiness, nervousness, sweating, dizziness or lightheadedness, sleepiness, confusion, difficulty speaking, anxiety, and weakness. A meal will be provided for you when fasting study procedures have been completed. Will you be able to fast for 10 hours?
All right. So as I mentioned, I'd like you to write a couple of ideas in the chat. Don't push send. Please don't push send quite yet. I will count slowly to 3. And then when I say send, everybody can send your possible challenges, and we'll see things kind of cascade in. So 1, 2, 3, send. Perfect. So yeah, we've got too much information at once, some technical information, jargon. Yeah, people might not know what biomarkers are. They might not know what some of the medical terms are, the scientific language. It's too intricate. Talked about a lot of information in a short period of time. It sounds like disclaimers at the end of an infomercial. Complicated words, yeah, perfect. We've got medical science jargon. So a lot of kind of the same thing. So too fast, too much information. Yeah, kind of disengaging. Perfect. And like I said, this was just a portion of a script. So you would have called and said, can I tell you about the script first? But just a portion. Yeah, it feels like it's not a conversation. I like that comment here that I'm seeing a lot of clinical information, no pausing. What is an MRI? So great. So these are some great challenges. Yeah, we also don't know what our listener would understand and not understand because we didn't really give them an opportunity to participate. So yeah, we're going to take another listen.
Thank you for being.
Oops, sorry here. So we're going to listen to the same portion, so just a small portion of a larger script. We'll listen to this same portion of the script, but we're going to hear a different delivery. I'm going to think about this time as you're listening, what are 2 differences between these 2 deliveries that stand out? So again, write 1 to 2 differences in the chat, but don't send until I say send. And you'll notice that the second recording, the recording we're going to listen to right now, is a little bit longer. And so kind of pay attention to that as well. All right. We will not be doing breakout rooms. We'll just do the waterfall chat today. So, all right, here we go.
Thank you for being interested and possibly participating in the Promoting Imaging, Longevity, and Optimal Thinking, or PILOT, study. I know that's a really long name. Don't worry at all if you don't remember it. Basically, the goal of the study is to learn more about how synapse health relates to cognitive function and Alzheimer's disease. Synapses are the tiny connections that allow brain cells to communicate with each other. So we want to know how synapses affect memory and thinking, especially in Alzheimer's. This study will collect biomarkers like blood and spinal fluid and brain scans to study synapses in various stages of health and disease. We will also look at how a gene called AP may help protect synapse health. So if you participate in this study, we will collect brain scans, blood samples, and spinal fluid to see how the synapses in your brain affect your memory and thinking. This will help us better understand Alzheimer's disease. Your participation is entirely voluntary, so you can choose to participate or not to participate. If you choose to participate, you will complete 2 clinic visits 2 years apart. Each visit takes approximately 6 to 8 hours, and you will be compensated up to $275 for completion of each visit, or $550 for both visits. I'm going to pause here. I'm giving you a lot of information, and I want to make sure I'm explaining things well. Could you please tell me what you've learned so far about the study?
The study is about how the brain works. To learn more about Alzheimer's, if I participate, I had to go to 2 appointments, and I get $275 for each appointment.
Yes, you will go to 2 appointments in 2 years. So participation in this visit would require that you fast from food, nicotine, caffeine, alcohol, and over-the-counter medications for 10 hours prior to or before a blood draw during the visit. Additionally, a 4-hour fast from caffeine and a 2-hour fast from nicotine will be asked of participants for an MRI scan. You can drink water as normal, and we encourage you to drink as much of it as you would like. So this is a lot of information. The most important thing to remember is that you cannot eat food or use nicotine, alcohol, or over-the-counter medicine for 10 hours before your visit. You can drink water. And we will give you a meal during your visit after the blood draw and the MRI scan. There are some risks with fasting. If you experience any of the following symptoms, please discontinue or stop your fast and contact us at that time. So watch for shakiness, nervousness, sweating, dizziness or lightheadedness, sleepiness, confusion, difficulty speaking, anxiety, or weakness. I'm going to pause again to make sure I'm explaining everything well. Can you tell me the most important information about the clinic visits?
I cannot eat, drink alcohol or caffeine 10 hours before the appointment, but I will get a meal during the appointment. If I feel sick, I should start fasting and tell someone.
Great. Yeah. Remember also that you can't use nicotine or over-the-counter medicine for 10 hours before the appointment as well. Great. So knowing all of this, will you be able to fast for 10 hours?
Yes, I can.
All right. So if you made a couple comments in the chat about some differences you noticed, please write those in the chat. So differences between the two different deliveries. And I'm going to count to 1, 2, 3, send. All right. So we've got slower speaking, pauses, explaining medical and scientific terminology, more of a conversation with the participant, a friendlier tone, easier to follow, using teach back, which we're going to talk about, slower conversational friendly tone, shorter sentences, pauses, requesting feedback, acknowledging that this is a lot of information, pausing, terms were defined, and the participant was prompted to speak. Good, a little bit more casual, highlighted the key information, breaks to check understanding. Let's see here, just going through. The slower pace was a relief for my tired brain. Love that comment. Yeah, simple words such as brain scan rather than medical jargon, deliberate pace, more information that could be important for decision making. Yeah. Let's see, slower pace. So still explain the purpose of the test. We're going to talk about that in a little bit too. Perfect. Getting clarification. So clarifies. All right, excellent. Thank you so much, everybody. So yeah, one of the things as I was preparing for this talk, I was talking a little bit with Ann and Allie because you've got some challenges, right? Once you have a script that's approved by the IRB, you can't make a lot of changes. And so we talked about how you can use plain language strategies to make the script that you have. You may not always have control over the language in the script, but you can use plain language strategies to make the script more accessible to participants. So you'll notice that the two examples, the script was the same, but the way it was delivered was different. So we used the same language, the same basic language, but paused or added a clarification or stopped to ask a question. So those are the things that we're going to talk a lot about today. I do also want to say that scripts wouldn't be quite so long if you do use plain language when you're writing the script. So I previously worked with some getting scripts approved by the IRB. And I was often really pleasantly surprised at how I was able to use a lot of plain language strategies in initial scripts that were approved. And I did notice that my scripts were much shorter and more accessible. So that's just something to keep in mind as well. So plain language is really plain language that your audience understands, or it's communication that your audience understands the first time they read or hear it. It's audience-centered, and the goal is that we are meeting our individual audience's needs. So in healthcare and research settings, plain language really addresses this ethical imperative of making sure participants and patients understand and can use the information they receive to make informed decisions in their best interest. So plain language is really defined by results. We know that our message is in plain language when our intended audience can find what they need, understand what they find, and use what they find to meet their individual needs, all after the first time they read or hear it. So that's a lofty goal. But during this session, we hope to give you tools and practical ideas that you can try out immediately. All right, so plain language. Plain language is respectful, it's inclusive and empowering. When we use plain language, we help our audience members make the most of their limited time. We also help them act quickly and confidently. So using plain language in research empowers participants to make informed decisions and to follow the study instructions confidently. When researchers use plain language strategies, they take responsibility and accountability for participant understanding. When we communicate in plain language, we're really considering the needs of our audience members. So what information do they need to make their goals, to meet their goals? And then how can we give a message that helps them process and act most confidently? So when you speak and you write with your audience in mind, you help participants decide quickly if a study is right for them. You make sure that participants actually understand exactly what they're signing up for. You build stronger relationships, so potentially boosting not just recruitment rates, but retention as well. And you improve not just your communication with study participants, but also with your study team. You reduce conflict and you build a sense of community and shared purpose. So let's look, I'm just gonna pop in the chat real quickly here. Okay, perfect. All right. So we'll look a little bit more specifically right now at plain language and research. So there are barriers to participating in research. And according to Using Plain Language in Research, a qualitative study published in got here, yeah, so published down here is our footnotes, and you'll receive these slides too, so you can look it up. But it was published in 2024, and researchers found that the following barriers really prevented people from participating in research. So first of all, terminology. When participants felt excluded or alienated because of the terminology used, they were less likely to participate. Tone. Now, our tone is so important. The words we use, the tone we strike can either engage people or alienate people. And so participants who chose not to participate in studies identified that the tone made them feel dumb or not respected. And not feeling like the participation contributes to positive change. So people wanted they wanted to connect their participation to specific topics and to feeling like they were actually making a difference. So I thought these were really fascinating things to keep in mind. So the way we communicate, especially the words we choose and our tone, they'll engage, empower, and motivate our listeners, or they will dissuade our participants. So you're responsible for considering the backgrounds, the needs, the barriers of your listeners, and then consciously creating messages tailored to engage and empower them. So remember that your listeners don't hear your information as often as you give it. And the reason they care about your message is different than the reason you care about it. So consider all of these things as you're creating your message, as you're explaining and talking with possible participants. Use familiar words, use a conversational tone, and explicitly tell potential participants why your message is important to them, what they gain, or how they help others through participating in your study. I really liked this from this research paper. I liked this quote a lot. The use of plain language is essential to build trust with communities and will enable research to be available to all people. Communities are interested in research, especially when it is contributing to a greater good. All right, so let's dive in to some specific strategies. As we talk about speaking in plain language, we are really looking at 3 different areas. We're looking at engaging individual listeners or participants. we are looking at setting up our listeners for success or reinforcing our message, and then taking responsibility. You have a responsibility to make sure participants understand your message and that you've explained information in a way that allows them to make confident, informed decisions. So when we look at engaging our listeners, we are talking directly to them. We're finding ways that we can help every listener know my message is for you, that my message is important to you. One great way to do that, to talk to individual people, to engage individual people, to help them see themselves in our message, is to use personal pronouns. So when you use personal pronouns, your listener pictures themselves in your message and they know without a doubt that the message is for them. A lot of people in our waterfall chats, you mentioned pausing. So just like in a written message, so when we have written messages, we have lots of white space, right? We like it when we see white space because that white space can help us process the words on the page. So we like to think when we're speaking that our pausing is the white space of our conversation. People have to have the chance to process and commit to memory the information that they're hearing. So presenting information in chunks and then pausing between the chunks allows our listener to hear, process, and then later remember our information more effectively. So we always say to be comfortable with silence. I am an English language teacher, so I teach people on campus who are learning or who have native languages, not English, and they are learning English as a second or other language. And I often in class count to 7. So I'll ask a question, and then in my mind, I'll count to 7 because it can be my instinct sometimes to keep talking. But then I remind myself, my listener is hearing the information for the first time, processing it, committing it to memory, and then thinking about a response. So very important. If you need to count in your mind, do that, but pause in between chunks of information. We also like to encourage folks to practice speaking in bullet points. So this is really saying a short statement followed by a 1-second pause, and then going on to the second statement, followed by a 1-second pause. So just imagine you're reading bullet points off a piece of paper. Try to talk in bullet points. That short, those short sentences, those short phrases with that pause behind it, that really helps people understand and process your information most effectively. All right. We also are really looking at the short talking turns. So as we're talking about chunking and pausing and using short statements or talking in bullet points, the idea is that we're creating this idea for interactive communication. So we're taking short talking turns. We're giving some information, and then we're giving an opportunity for our listener to participate. And we're giving some short information again and another opportunity for our listener to participate. So we know that using this short talking turns, it helps us be clearer and sound more confident. When we use short talking turns, we are less likely to be interrupted. And our audience members or our listeners are less likely to kind of lose interest, start thinking about what they have to buy at the grocery store, whatever. We're keeping our listener more engaged. So just, keep that in mind. Present information in short chunks, pause. And when you pause, you're pausing, letting people process the information, and then finding a way to invite them to participate in the conversation. And finally, to engage our listener, we want to simplify. So this really means we're going to use fewer words and shorter active sentences. When we read long, demanding sentences, we often have to reread them to understand them. So imagine how much more difficult it is for people to understand or process long sentences when they're listening and they don't have the chance to reread that long sentence. So we want to, again, break long sentences into short, simple sentences or phrases and focus on your word choice. Use as few words as possible and make sure that the words are familiar. Make sure that you are not using jargon and acronyms that might alienate or turn off your listener, that you're using words that they are comfortable with, that they hear and use on a daily basis. And then when you do have to use jargon, which we all do sometimes, that you're explaining that and using those familiar words. All right, so we've talked about how to engage your listener. Now let's talk about how we reinforce our message. When we're speaking, we want to start and end with the most important information. So usually people can't go back and re-listen to us like they can reread an email or a policy. So when we start and we end with the most important information, we're engaging our listener up front, telling them exactly why this message is important. And then we're ending with that same most important information to help them remember it as we end the conversation. Write it down or use body language, visuals, props, and drawings. Visuals create stronger, more accurate memory recall. So visuals, they help our listeners picture our message, engage with it, and remember it. So use pictures, diagrams, drawings, use the physical space and the objects around you to show your message while you're saying it. So can you model what you're saying? Your listeners will be more likely to remember your message accurately if they're able to hear the message and see it. They'll be better able to process, to commit that to memory. I know that many conversations you have are via phone. So if you're talking with someone on the phone, you can't really use visuals, but you can consider concrete examples. So if you can't illustrate your message with visuals, think about how can you kind of create a visual image, help your listener create this visual image in their mind. So for example, if we're talking about synapses, you could say synapses are like bridges that help different parts of your brain talk to each other. So if you're talking on the phone, you can't actually show a picture of synapses, but you could give that example to help your listener try to picture it, just one more way that they will better process and remember your message. We just want to say you can connect with Allie and Anne to kind of talk about, get some other examples of how other study teams have incorporated visuals in their materials to supplement verbal explanations. So for example, they mentioned that they've used information sheets with lots of figures and images to explain study activities. And Anne does say that, just a reminder that adding the imagery does require IRB approval, but that they're seeing more study teams do this. So definitely reach out to them, with any questions. All right, and finally, taking ownership of understanding. So it's your message, it's your responsibility to make sure that your listener has understood your message in a way that helps them meet their needs. So first of all, we want to ask open-ended WH questions. So in English, we have two types of questions. We have open and closed. And those closed questions are, do you understand? Does that make sense? Do you have time to help me? So they're questions that can be answered with yes or no. they don't give us a lot of information, and most of the time people say yes or nod. So we want to avoid yes, no questions. And we want to switch it up with WH or open questions. So those WH questions are questions that use those question words: who, what, where, why, when, how. So instead of saying, do you have time to help me? You can say, when can you help me? That obviously requires a very different answer. When you ask, so you'll notice if we look back to the beginning example, I didn't say, so, did you understand everything about the clinic visits? Do you have any questions? Because probably our participant would say, oh, yeah, no, I'm good. And we wouldn't really know, did they understand or not? So I said, what was the most important part of the clinic visit? So I asked a WH question that required the participant to say actual meaningful information, what they actually understood. And then I listened and I noticed, oops, they left out the nicotine and the over-the-counter drugs. So that gave me I was able to immediately hear what my listener understood and what I needed to say again or reinforce. On that note, we want to avoid tag and negative questions. You know what tag questions are, don't you? So this is an example of a tag question. Tag question is basically a statement that we use to usually to confirm or check what we already think to be true. And then we add a little short question on the end. So we have a statement, a comma, and then a little question tag. So for example, you're coming to the meeting, aren't you? That is a question, but it's a tricky one. It's a tag question, and it's really confirming you need to be at the meeting. You're coming, aren't you? We hear tag questions all the time, and but when we really look at it, we can see that they're very difficult to answer. They're difficult to answer for that idea that culturally they're often used to say what should be true, what we believe should be true. And then grammatically, they're a little bit tricky also. So a negative question is similar to a tag question. It uses a negative word, and we often use them to express surprise, disbelief, or to confirm something we think to be true. So for example, aren't you coming to the meeting? That's an example of a negative question. So we often, in native English speakers, we form these questions effortlessly, but they're a little bit more difficult to answer. A few weeks ago, I noticed myself. I asked my 15-year-old, I said, oh, Oliver, you didn't do your homework again, did you? And he said, yeah. And I said, yeah, you did your homework? He said, oh, Mom, no, I didn't. So I talk about this almost every day, and I still found myself using this tag question and having this miscommunication. So we want to avoid those tag and negative questions. And then finally, a couple people actually in the chat already mentioned this, using teachback. So teachback is also called the show me method. It's a research proven method to improve communication. Used a lot in healthcare, but we're finding that it's used very often now in other spheres as well. When you're using teachback, you are basically taking ownership of the understanding, and you're being clear about that. You're saying, I know this is a lot of information, or I know I'm giving you a lot of information. And then you're putting the responsibility on yourself. You're saying, I want to make sure I'm doing a good job. I want to make sure I'm explaining things well. Then you're giving your listener the chance to say what they understood in their own words. So some things that I like to use, some prompts are, what will you tell your family? How would you explain this to a coworker? When will you arrive? So using those WH questions to hear what your listener actually understood. And if there's any miscommunication, if your listener says something that's incorrect or different from your intended message, then you reshare your message. You just realize then that you hadn't shared your message in a way that your listener could understand it. And so you reshare it and then try teach back again. So let's look at an example here. If you are reviewing a consent form, you might say something like, I gave you a lot of information and I want to make sure I did a good job explaining how you will participate in this study. Can you tell me what you'll be doing in this study? And then you listen. Listen to hear, what your listener understood. And if there's anything that you need to clarify or re-explain, do that. All right, so here I want to take a moment to give you the chance to talk or to kind of consider a little bit. We will just, we'll take about a minute and a half, just as an individual reflection. So consider a research study you're working on and consider that you've just explained potential risks or potential benefits of participating in a study. How could you use teachback to confirm a patient's understanding? So we'll take a couple minutes to do just an individual reflection. And I'd love if you want to share your ideas in the chat, please do. If you've got a question that you would ask, please pop it in the chat. We learn so much from each other. But for now, I will mute myself for about a minute and a half. And then I do encourage you to share your ideas in the chat because like I said, we learn a lot from each other. All right. Excellent. I'm seeing a lot of messages already. So please, if you've got something to share, please pop it in the chat so that we can all take a look. All right. Great. I'm going to read some of these out loud. So I love these ideas. What are a few of the risks that are most concerning to you? Or what are some of the benefits that are most enticing to you? I love that because then you're really finding out also what matters to your participant and how they're hearing what you said in a way that they're connecting it to what matters to them. Asking someone just very simply, if you participate, what could go wrong? I love that. And I like this too. So telling a participant, being very transparent. We know plain language builds trust. What did I say just now that made you go, whoa, wait a minute? That's a risk. So what surprised you? What's making you worried? What are the risks involved? I want to make sure I did a good job explaining the potential risks of the study. Would you please share some of the questions you have? Perfect. Yeah. Can you help me know if I explained this well? I like that a lot. What are some of the risks? Yeah. Oh, I like this question or this comment to encouraging everybody to participate in a clinical trial so that you can be on the other side. You can hear and experience what it feels like. That's a great idea. Excellent. And then this last comment here, if you wanted to tell a friend what the good things are about doing this study, what would you tell them? That's wonderful. I love those prompts. Thank you so much, everybody. Those are wonderful examples. All right, let's, as we wrap up, let's look at how you can practice plain language. Plain language does take time and effort. When you invest on the front end, though, it really does help. It saves time and money and effort and miscommunication, frustration on the back end. So when you use plain language, more people understand you the first time, they follow through better and faster, and they're happier and more confident in doing it. So keep up this plain language momentum. You can review the plain language resources that you'll receive after the training. Visit, this is the new plainlanguage.gov. So just this week, plainlanguage.gov, it's a website I use all the time. It got a makeover. So this is the new address. Consider how you can start with plain language. So we're talking about using spoken plain language strategies with scripts you already have. But how can you develop scripts using plain language strategies from the start? Make sure your scripts work. So get feedback from users. So this is let's talk a little bit more about this. So what I would recommend is if you've got a script, try to get feedback from a couple, maybe 2 to 3 people who represent your target audience. And choose a recruitment flyer or a phone script that you're going to be using soon, or that is you use frequently. So when you're picking people, if the study is intended for older adults, try to consider, do you have older family members or friends or colleagues who work in a different part, who aren't as familiar with your research study in your topics? Can you ask them to help you out? And when you meet with these 2 to 3 people, you want to ask WH questions. So for example, you could show a flyer and you could ask things like, where did your eye go first? What's the most important information on this flyer? What questions do you have after reading this flyer? What would you do after reading this flyer? What sections or words did you have to read more than once? Or if you read your phone script aloud and you want to get feedback on your phone script, you might ask, what would you do in this study? What do you do next if you want to participate? How will your participation in the study help you or your community? What questions do you still have? So asking those WH questions to get feedback. Anytime I do this, I learn so much and I make a lot of really beneficial edits to my messages. Attend more plain language workshops to earn your CLS plain language certificate. We'll look at that in just a minute. And then join the plain language community on Teams. So you can go to Teams, and I know that Anne and Allie are going to put a link in the chat. You can join with this code right here. It's not you don't get a ton of messages, but it's a really fun team to be involved in. We kind of brainstorm things with each other, share up and coming training, some, just things that we're seeing out and about. All right. So the plain language certificate, it's a 3-part series. Introduction to plain language is 90 minutes, and then Write with Plain Language and Design for Plain Language are both 2 hours each. You can take all of these online or in person, or you can complete a 4-week online Canvas training. It covers the same information as the 3-part training. It's just online on Canvas. And either option, you can earn a plain language certificate. After you earn the plain language certificate, you can continue your plain language journey in our plain language network. We offer plain language lunch and learn every other month. So sometimes we have guest speakers, sometimes it's a chance for us to network or to practice specific things we're working on. It's a really fun group. All right. Thank you so much. We have time for questions. If anybody has any questions, you can unmute, you can write in the chat. I'm actually going to stop sharing my screens and just see everybody.
Hi, I have a question, and I apologize because I'm driving, so I was listening to the presentation, but excellent presentation. Thank you so much. You mentioned some studies having kind of good visual documents that have been approved by the IRB. And I'm wondering if there is a library of such documents that have already been IRB approved that other study teams could use as like a basis or starting point for developing their own materials. And then also with regards to IRB approved scripts, like you said, you know, the difference between the first example and the second example was pretty stark, but it would be even better if we were starting with plain language in our script. And so if there are any IRB approved examples, you know, I will say I think a lot of the IRB approved required language is not great. The scripts are often front loaded with really complex language about how we're handling your data, and that's before we even get into the meat of the study. So if there are resources like that, would it be possible to share them?
I will let Allie and Anne answer those wonderful questions.
So we actually have been slowly collecting materials that are posted publicly. We are coming soon in the future planning on creating that resource library that study teams can access, kind of similar to the protocol library that's on campus as well that you can access through Box. So that is coming soon, but Anne and I are happy to send examples if you have something specific you're looking for. So you can feel free to email us and we can, you know, provide some examples that way, but it is coming soon. And then we're thinking in the spring as a future workshop idea of having kind of a show and tell or a share and tell, where if study teams have really amazing materials that they want to share out and kind of talk about the process of creating those, you know, any IRB considerations that maybe they've gone through, that is something that we're hoping to do in the spring. And anything else related to that?
I think it's a great question. Thank you.
And as I mentioned, I have had really good luck and or experiences. It does take some back and forth, but I've had some great experiences advocating for different changes, or using plain language strategies and organization in getting scripts approved by the IRB. Not everything, obviously, that we had hoped for, but I have been happy with some of the things that we've been able to advocate for. So you don't, you know, so definitely ask. Yeah, thank you so much for those questions. I want to look at a couple questions in the chat. Here's one. Do you have recommendations for consent forms and other documents that need to be translated into another language? Thank you so much for asking this question. So Cultural Linguistic Services on campus, my department, we house the interpreters and the translators. And we actually have a department policy that we really encourage anybody who asks us for translation and interpretation that they do a plain language edit first. So before a message would go to our interpreters and translators, it would come to myself, to me and my coworker, and we would do a plain language rewrite, and then it would go to translation. It is well known. It is definitely, you know, I think translators and interpreters would say it. I think patients would say it, participants. When you can translate a message that's already been written in plain language, the translation is much better. It's much more accessible. We actually know that sometimes when folks get a message that's been translated into their native language, they are less likely to ask questions because they feel like, oh, I should understand this. But you have to remember that literacy levels, folks who are in the United States, maybe they may speak a native language that they're not literate in, or they're not extremely literate in. And so we have to be so careful that we're not just saying, oh, I translated it, it's fine. So the plain language review first, and then the translation is definitely what we would recommend. Oh, my tone changed when I posed the negative question. Yeah, culturally negative questions are often they're just culturally they're used a little bit differently, not always, but that particular example, you're coming to the meeting, right? Often our negative questions are to actually communicate something that we expect or hope to be true. And grammatically, they're just harder to respond to. Yes, so do I recommend using ChatGPT to make information simpler? If so, what prompts work? Yeah, thank you for that question. So at UW, we're really not supposed to use a ChatGPT. We're supposed to use Gemini and Copilot because we have, they've been vetted by our IT department, and we have contracts with Copilot and Gemini so that they're not storing our prompts to train their models. So I do use it. Yeah, I do use AI. I have found that when I used AI quite a bit for this also because I had to learn, I got the script and then I had to learn a lot about it. I didn't understand all of it. And so I have found that AI can be a great initial, edit, or it gives me some initial ideas. I've never been able to put something in AI and just run with it. I think it always does require a human touch. But then sometimes I'll also ask AI, I'll write something in plain language. Usually if it's medical or science or really jargony, I'll write the original and then my plain language version and ask if it's correct. So that's kind of how I use AI with plain language. We actually just had a lunch and learn a couple months ago on using AI for for plain language. Well, thank you so much, everybody, for attending. I can stay on for a couple more minutes if you have questions in the chat or unmute.
Thank you so much, Beth. Very useful.
Thanks so much, everybody.